Respected audience, Assalamu alaikum. I am Professor Shamsuzzaman, Professor of Pathology. I welcome all in today's 45th lecture on pathology. Today, day 11 of Neoplasm. Day 11 of Neoplasm. Dear audience, today's topic is Paraneoplastic Syndrome. Paraneoplastic Syndrome. Paraneoplastic Syndrome. Dear audience, we know Neoplasm is an abnormal mass of tissue, growth of which exceeds and is uncoordinated with that of normal tissue and persists in the same excessive manner after the cessation of stimulus that evoke the change. And you also know this definition is given by British oncologist Sir Rupert Willis. Neoplasm is nothing but an abnormal mass of tissue. And you know, cancer is malignant tumor. Syndrome parallel to neoplasm, syndrome parallel to cancer is known as paraneoplastic syndrome. Now come to definition of paraneoplastic syndrome. Syndrome seen in about 10% cancer-bearing patient. So, parallel to neoplasm, that is syndrome, paraneoplastic syndrome. Syndrome seen in about 10% cancer-bearing patient that cannot readily be explained. That cannot readily be explained either due to elaboration of hormone by tumor or due to local invasion or distant metastasis is known as paraneoplastic syndrome. Dear audience, again, syndrome seen in about 10% cancer-bearing patient. This symptom complex, this syndrome seen not in all cancer-bearing patient, it is seen in about 10% cancer-bearing patient. That cannot readily be explained, whether it is due to elaboration of hormone by the tumor, or it is due to local invasion of the tumor, or it is due to distant metastasis of the tumor. And this syndrome, this symptom complex is known as paraneoplastic syndrome. Suppose 100 patients suffering from cancer. Out of 100, about 10% cancer-bearing patient suffers from such type of syndrome. And suppose this is cancer. This is cancer. Parallel to this cancer, there is syndrome. And what is the cause of this syndrome? It is not clearly explained. It may be due to hormone secretion by tumor. It may be due to hormone secretion by this tumor, or local invasion, or due to local invasion of tumor, or this syndrome is due to distant metastasis of this cancer, or due to distant metastasis. Dear audience, suppose 100 patients suffering from cancer. Out of 100, about 10% suffers from this Paraneoplastic syndrome, and this syndrome parallel to the cancer. And this syndrome either due to hormone secretion by the tumor, or due to local invasion of this cancer, or due to distant metastasis of the cancer. And this is known as Paraneoplastic syndrome. Dear audience, we know syndrome is the symptom complex. Now come to what are the symptoms may be seen in Paraneoplastic syndrome. Symptoms in Paraneoplastic syndrome: sudden flushing, palpitation, hypertension, watery diarrhea, vomiting, etc. So the symptoms are sudden flushing, palpitation, hypertension, watery diarrhea, vomiting, etc. Dear audience, now come to some examples of Paraneoplastic syndrome. Cushing syndrome. Cushing syndrome is due to elaboration of hormone ACTase by odd cell carcinoma. Due to elaboration of ACTase hormone by odd cell carcinoma. Dear audience, odd cell carcinoma is one of the small cell carcinoma of lung. It is one of the small cell bronchogenic carcinoma. That is, odd cell carcinoma is one of the small cell bronchogenic carcinoma. And this carcinoma secretes ACTase. And due to this elaboration of such type of hormone, patients suffers from Cushing syndrome parallel to bronchogenic carcinoma. So it is Paraneoplastic syndrome. Carcinoid syndrome. Carcinoid syndrome is due to elaboration of serotonin. Due to elaboration of serotonin. And this serotonin is secreted by carcinoid tumor, that is the locally malignant tumor that arises from the neuroendocrine cells, carcinoid. So carcinoid syndrome parallel to carcinoid tumor due to elaboration of serotonin by carcinoid tumor in appendix or in lung etc. So if anybody suffers from carcinoid malignant tumor of neuroendocrine cells, either in the appendix or in the lung, etc., this carcinoid elaborates serotonin, and due to serotonin parallel to carcinoid, there is syndrome that is known as carcinoid syndrome. And carcinoid syndrome comprises with sudden flushing, watery diarrhea, asthma like wheeze, etc. Another example of paraneoplastic syndrome, polycythemia. Dear audience, you know, increased number of RBC, WBC and platelet per unit volume of blood is known as polycythemia. Polycythemia due to secretion of erythropoietin by renal cell carcinoma. Dear audience, if anybody suffers from renal cell carcinoma, this is renal cell carcinoma, it will liberate erythropoietin. This erythropoietin acts upon the bone marrow. And bone marrow is stimulated, so there is rapid production of RBC, WBC and platelet, and that leads to polycythemia. So polycythemia is one of the example of paraneoplastic syndrome parallel to renal cell carcinoma due to elaboration of erythropoietin by the renal cell carcinoma. Hypoglycemia. Hypoglycemia is due to elaboration of insulin or insulin-like substances. Due to elaboration or secretion of insulin or insulin-like substance or insulin-like substances. This secretion of insulin or insulin-like substances by fibrosarcoma. Dear audience, you know fibrosarcoma is a malignant neoplasm that arises from the fibroblast. If anybody suffers from fibrosarcoma, it may secrete insulin-like substances or insulin, and that will lead to hypoglycemia. So hypoglycemia is a syndrome parallel to cancer fibrosarcoma. Another example of paraneoplastic syndrome is hyponatremia. Dear audience, this hyponatremia is due to inappropriate secretion of ADAs or ADAs-like substances by bronchogenic carcinoma. Inappropriate secretion of ADAs or ADAs-like substance by bronchogenic carcinoma. Bronchogenic carcinoma. Dear audience, inappropriate secretion of ADAs or ADAs-like substances by bronchogenic carcinoma is associated with hyponatremia. Hyponatremia is a paraneoplastic syndrome parallel to bronchogenic carcinoma due to inappropriate secretion of ADAs or ADAs-like substance. So it is one of the paraneoplastic syndrome. Respected audience, I have told you it is symptom complex or it is syndrome parallel to cancer and seen in about 10% cancer bearing patient, and it cannot readily be explained whether it is due to hormonal elaboration by the tumor or due to local invasion or distant metastases. Now come to what is the importance of paraneoplastic syndrome. Paraneoplastic syndrome that is found parallel to cancer. This may be the first manifestation before the diagnosis of primary tumor. Paraneoplastic syndrome may be the first manifestation before diagnosis of primary tumor. So, before diagnosis of primary tumor, before diagnosis of the cancer, paraneoplastic syndrome may be the first manifestation of the patient. If an old patient comes with hypertension, palpitation, watery diarrhea, sudden flushing, etc., if we consider it could be a case of paraneoplastic syndrome, and if we search, then we can diagnose the primary tumor. So, paraneoplastic syndrome may be the first manifestation before diagnosis of tumor. Paraneoplastic syndrome in cancer-bearing patient is due to local invasion or distant metastases. Paraneoplastic syndrome in cancer-bearing patient is due to local invasion or distant metastases. Dear audience, suppose a patient suffers from bronchogenic carcinoma. Patient suffers from Dear audience, suppose patient suffers from bronchogenic carcinoma and it is diagnosed case. If after few months of diagnosis, patient come to you with paraneoplastic syndrome. This paraneoplastic syndrome after few months of diagnosis of bronchogenic carcinoma is due to invasion or due to hormonal elaboration or due to distant metastases. So, paraneoplastic syndrome in cancer-bearing patient is due to local invasion or due to distant metastases or due to hormone elaboration. So, these are the importance of paraneoplastic syndrome. One, before diagnosis of primary tumor, the syndrome may be the first manifestation. Another one, after diagnosis of the primary tumor, if there is paraneoplastic syndrome, you can say it is either due to hormonal elaboration or due to distant metastases. These are the importance of paraneoplastic syndrome. Dear audience, today's topic is paraneoplastic syndrome. It is symptom complex parallel to cancer. It is seen in about 10% cancer bearing patient that cannot readily be explained, whether it is due to hormone elaboration by the tumor or due to local invasion or distant metastases. The symptoms are palpitation, hypertension, sudden flushing, watery diarrhea, vomiting, etc. And there are some examples of Paraneoplastic syndrome, and these are the importance of Paraneoplastic syndrome. Dear audience, to adapt to this, thanks all.